Hi, welcome back to Connect with MOBEC, the video series. I'm Jay Shubrook, a physician and the leader of the diabetes services for the MOBEC team. Today, I'm delighted to have with me Suneet Dhillon, Pharm D, who is going to talk to us about medication therapeutic management and how it can help you. And I would urge you to listen to this because it can really make your diabetes care safer and more effective. Dr. Dhillon, thanks for joining us today.
I'm glad to be here.
So what is MTM?
So MTM, it stands for Medication Therapy Management. Essentially, it's a one-on-one patient-centered service, usually provided by pharmacists, but it can be typically provided by any healthcare professional. But essentially what we're doing in a nutshell is looking at all the patient's medications and determining if those medications are first appropriate for the patient themselves and for their condition, if they're safe, and as well as evaluating the medication's efficacy as well.
Yeah, and my patients with diabetes are on a lot of meds, and so that'd be very important to kind of be able to see some of these factors.
Definitely.
So I'm a patient, and maybe I've recommended to my patient that I'd like them to get MTM. What can they expect, and what should they bring to that appointment?
Yeah, so essentially what we want, in order to do the service, we would have to first gather all the health data and all the medications. So typically when we do schedule an MTM service, we ask a patient, usually it's done in person, but it can also be done over the phone. We ask them to bring all of their medications. This includes their prescription medications, anything over the counter like Tylenol or Advil, for example, any vitamins and supplements. And then we sit together, we go through all the medications, how they take it, and see how they're supposed to take it. And, that way we kind of determine, are they taking it appropriately, or sometimes they probably shouldn't be taking two medications together. So we look at all of that. Furthermore, we provide any educational materials. Essentially, diabetes itself, it's a complicated condition for some people to understand. So we really try to make it easy for them to understand so they can be active in managing their condition. So we do all that. We follow up with you throughout as well to see if you have any questions furtherhand. And if we have any recommendations, we can actually contact the patient's physicians to determine or to ask or provide the recommendation we have that can help patients that way.
So you work with the healthcare team to really provide the kind of safest medication regimen possible.
Exactly. At the end, it's gonna be the patient that's gonna be the focus, and we're just really trying to help, do whatever that's best for the patient.
Wow, that's really great. So as we're thinking about the patient getting MTM, what are they going to see? It sounds like there's going to be some coordination, but what can I say I'll feel good about at the end of that visit?
Yeah, so then like we said, we'll be evaluating the medication. So we'll be looking at the doses, for example. Is that dose appropriate? Maybe that patient's on a too high of a dose. For example, elderly patients might be not tolerating a medication as well as they should. So we can probably recommend the doctor, this patient's not tolerating it, let's go ahead and decrease the dose. Same with interactions, or they're probably taking two of the same medications or are very similar, which it wouldn't really make sense for them to take both. Sometimes patients, they don't like continuing on a medication because of side effects. They're complaining that they're experiencing side effects which stop them from taking the medication. Well, with this MTM, what we can do is, we can look for an alternative. Maybe there's a different medication with less side effects, which will help promote, patients to take the medication. Again, we're really there to kind of answer any questions and make it easy for the patient. We can also look at cost savings as well. Sometimes physicians, they prescribe a medication that's not covered by their insurance. And at the end, the patient has to be having to pay more. So we really want to make sure that patients don't pay more than what they have to for their medications. So we can really work with the patients as well, look at their plan and see which medication can help them save money as well as giving that same benefit of lowering A1C, for example, for patients. But it's really overall patients with this service, they've always had a positive medication experience and they have better results. And the main goal of MTM is just to have patients be more active in managing their health, their condition. And I really believe that MTM really allows the patient to do that.
Yeah, and as a physician that has many patients, I really do try to prescribe the safest medications, ones that are covered. But these formularies are changing all the time. Many of my patients see multiple physicians or multiple providers. And that holistic look that you take when you do MTM, I think is really an important point for safety. And many of my patients leave with a medication list with times of the day that they should take things. And I think those things are really tangible benefits, let alone the potential of saving money, which would be huge.
Exactly.
So, we talked about costs. What's the cost for this service?
So MTM, typically it's covered service, especially for Medicare Part D patients and any insurance plans that sponsors Medicare Part D. It's mostly covered, but it really depends if you meet their eligibility criteria. They have a certain 3 criteria that the patient has to meet. And if you are, the insurance plans, they should provide some type of a communication either through email or mail that you are covered. But if not, it's best just call your insurance plan just to double check. And if you are, the next step would be just to speak to your pharmacist or to determine if they provide MTM. And that would be perfect. Then you can definitely take the full benefits of this service.
So for the majority of people that have this as a covered benefit, it could be free for them.
Exactly, fully covered.
So I think this was such an important topic today, and I would encourage all of our patients out there to do that extra step and be able to learn about your medications, learn how we can make them safer, and potentially even make them cheaper. And, Dr. Dhillon, as being part of our team, a pharmacist can really add a lot of value to our management team, and we really appreciate the work you're doing.
Exactly, thank you.
For all of you, we hope you've enjoyed this topic. We feel like this is something we want you to know about. If you want to hear more or more information, tips, or other suggestions, please go to our social media pages as listed here. And we welcome your comments and questions, and we will bring Dr. Dhillon back to talk about this further if you have things you would like to talk as it relates to MTM. Thank you for joining and watching Connect with MOBEC.